and welcome everyone to the Shishmut U-sponsored webcast, Pulling the Rabbit Out of a Hat, How Hospital Marketers Can Influence Cost, Outcomes, and Patient Experience. Today's program is being sponsored by LexisNexis Risk Solutions Healthcare and is being presented by Richard Grape, Director of Market Planning, and Tim Kringle, Vertical Solutions Consultant, both with LexisNexis Risk Solutions Healthcare. At this time, I'd like to turn your attention to the right-hand side of the screen. Feel free to type any questions you have during this presentation into the Q&A section. We will hold all questions until the end of the presentation, at which time we will address as many questions as time will allow. Also, I'd like to remind you to please keep your phone lines on mute. We are recording this call, and we want to avoid any unwanted noises and or distractions. At this time, Richard, the floor is yours.
Thank you very much. My name is Richard Grape. I'm a Director of Market Planning at LexisNexis Solution in our healthcare vertical. In this role, I serve as part futurist, part visionary, and really as a strategic leader that directs our overall market, product, and sales strategy as it pertains to both the healthcare industry and to government nationwide. For some background on me, I hold a Bachelor of Arts from St. John's College in Annapolis, Maryland, an MPA from Cornell University. I bring to my background pretty robust expertise in government and healthcare policy, public-private partnerships, as well as less traditional disciplines like political theory, classical studies, and philosophy. Currently, I direct our claims analytics strategy, and as such, I build and innovate different solutions for the provider, life science, and payer markets. I'm personally a very passionate advocate for sharing data. I've led multiple different contributory initiatives, including the National Accuracy Clearinghouse, which just passed in the Farm Bill. I'd like to also introduce my colleague, Tim Kringle, and let him introduce himself. Go ahead, Tim.
Yep. Good afternoon. Thank you, Rick. My name is Tim Kringle, and I'm a vertical solutions consultant with LexisNexis. And what that means is I'm a subject matter expert within our company for our medical claims data. So I work with customers across all the different sectors of healthcare to design and optimize solutions that are built off of our medical claims database and help to address the business objective of our provider customer base, our payer customer base, as well as pharmaceutical and medical device and the other markets that we work in. So I look forward to speaking with you today. Hopefully there's lots of great questions and Q&A back and forth. And Rick, I'll hand it back over to you.
All right. Thank you, Tim. First, for all of those that have joined us today, I'd like to thank you for participating in this webinar. As a refresher for those on the call, today we're going to discuss what to some might seem a little bit like magic, pulling a rabbit out of a hat, so to speak, talking about how hospital marketers can really influence cost, outcomes, and patient experience. For hospital marketers and strategic planners, to influence patient care and outcomes might seem like it's trying to perform a magic trick, so to speak. But the truth is it doesn't take magic. It's just taking access to the right information. So today we'll touch on topics such as creating more powerful physician alignment strategies and building better clinically integrated networks. We'll talk about how hospital marketers can influence patient experience and outcomes, gain additional market share by understanding the different service lines and growth and referral patterns, as well as to talk about the right types of data that you may want to find in order to understand your market and your physician connections. Our presentation today will consist of three main sections. To begin with, we're going to start with a conversation on the move to consumerism and the importance really of the patient experience. We'll then move on to how quality insight into the market, providers and their behaviors can improve marketing and strategic planning. And then we'll sum up and come full circle to talk about what types of data can really influence cost, outcomes, and the overall patient experience. To begin our discussion today, we're going to focus on that first one, specifically the move to consumerism. This is a prominent trend in the market that continues to gain traction throughout the healthcare ecosystem and really has become a significant driver as organizations seek to tackle the triple aim, reducing the cost of care delivery, improving patient outcomes, and ultimately enabling a better, more satisfying patient experience. This market shift is hallmarked by a strong shift towards alternate payment models, or APMs. This is really indicative of value-based care approaches. Level setting, as we all know, 10 years ago, the healthcare insurance industry was paid largely on volumes. Over the past decade, we've seen a shift in the number of services to the quality of those interactions, with market attention driving an increase in accountability. Volume-based reimbursements are still commonplace though they are beginning to trend towards that more value-based care model. In the market today, we see four major categories of payment models. Category one are really the traditional fee-for-service payments that don't have a link back to quality. These payments are not adjusted to account for either infrastructure investments, provider reporting, quality data, or provider performance on quality or metrics surrounding cost. Category two are really those fee-for-service payments that are linked to quality, and these are adjusted based on infrastructure investments to improve care or clinical services, as well as whether the providers report quality data on how the provider is performing on different cost and quality metrics. The ones I'm going to spend most of the time on the next two slides talking about are really the Category 3s and Category 4s. Category 3s are the APMs that are built on the fee-for-service architecture, moving and providing mechanisms for more effective management tied to different procedures, episodes of care, and overall health services that are provided for individuals. These track things like cost and performance and hold different providers accountable for performance on appropriate care measures. The Category 4 are the population-based payments, and these are driving providers to deliver really person-centered care, and this ties back to our consumerism discussion. These payments hold providers accountable for quality and person-centered care goals, including things like preventative health, health maintenance, health improvement, and different acute or chronic care services. On these category types, APMs account for roughly 35% of payments, but this actually represents 77% of the covered population, or roughly 226 million Americans. Moving to the next slide. This shift really represents the move to consumerism, or the patient-centric approach. And while fee-for-service continues to represent a high percentage of payments, the fee-for-service decline is already well underway. Just in the past year alone, we saw a 2% decline, with many industry goals now setting to see that shift at up to 50% or more within the next 5 years. I'd like to shift your focus from the need to impact outcomes, costs, and experience to some of the more tactical blocking and tackling that can be done to drive this change, specifically on a patient level. All of this, of course, starts with patient engagement. And this matters to marketers and strategic planners for a number of different reasons. Engagement, it enrolls not only the patient, but their families. It allows them to become invested in their health outcomes. And really all of these parties work to hold each other accountable and produce more favorable results. Patient experience also results in high levels of clinical outcomes. Those who believe and focus on increasing engagement initiatives, these folks saw a significant decline with common challenges such as medication errors, falls, and length of stay. And really by effectively engaging clients, marketers have also seen a sharp rise in customer loyalty, which in turn really affects their reviews, 32% of which will actually impact all future consumer interactions that you might have. Perhaps the most important aspect of patient engagement is that a happy customer is more likely to stay within your system, stay within your network, and with each patient having roughly a lifetime value of $1.4 million to each organization, a positive patient experience is critical. It'll influence their choices for health services for many years to come and can help drive significant more business to each of the different networks of which they're comfortable. The last sentiment that I highlighted, I think really starts to drive towards a broader model, and that's really the need to effectively gain consumer mindshare and keep their interactions and associates within your healthcare system and make them be a positive one. Currently, we're in the age of consumerism, and our industry's diverse provider ecosystem, it really offers individuals a lot of different choices. With roughly 8.5 million practitioners nationwide, consumers have a lot of options. They can pick and choose when, where, and from whom they ultimately would like to receive services from. In many ways, healthcare services are becoming more and more like a shopping mall, with consumers picking and choosing who they want to manage their health and why. Some of these things are on the surface, visual in nature. Some of these are tied to engagement, repetitive outreach that occurs after the fact, but ultimately it's tied to that effective patient engagement model. And that is necessary not only to gain, but ultimately keep their attention. As an example of this, I'd like to talk briefly on a personal note. So my wife is currently pregnant. It's our first, so many changes are ahead in our lives. But life events like this can actually greatly determine where in the future my family will likely go to receive health care. For instance, if your doctor doesn't require you to go to a specific hospital, Hospital A, that hospital will likely miss out on a number of future client life events as a result of not having been directed there in the first place. Now, I think we'd like to pause for a moment and talk a little bit or offer up a polling question. For those of you that are seeing on the screen, our polling question is, which external pressure is the top priority for your strategic planning initiatives? Is it A, market dynamics, B, changing patient populations, C, consumerism, D, merger and acquisition, E, the shift to value-based care, F, physician or practice employment and clinical integration, or G, understanding clinical service line gaps?
You have to open poll.
And this should be available on your screen over on the right under the communication window.
And Rick, as folks are kind of the poll, I was thinking too, as you were talking about, your new family and the choice, and thinking about just for myself and my family, certainly if you're going to get a plumber, you're just going to go online and read reviews. And healthcare is never going to go that far. But, 10 years ago, I never went on the internet to read reviews of a doctor or a hospital or a clinic before I was going to get health care. I would talk to my doctor, take their advice generally, and go from there. I think in healthcare, generally, folks are going to still heed their doctor's advice more than anything else. But for smaller issues, for things like that where you don't need to go to the doctor or it's inconvenient, it's amazing how much information, Google reviews, health grades, I've read them when I signed up for a new dentist and we switched insurance companies. I looked on the insurance website first, and then I went over and read all the reviews online. And it truly is becoming more of a consumer-driven model.
And Tim, I'd like to support that as we were evaluating which hospital we wanted to have our child at, as well as location of our practitioners. The reviews were something that we definitely were steered toward, looking at who had positive customer experiences, what their ratings were, using Google, health grades, different assets like that, as well as the payers' actual rating systems themselves.
Excellent. And I think the poll has paused, so we can probably move on from here. It from my view, looks like the time cut off. So
it does seem that the shift to value-based care, for those that were able to participate in that poll, seems to be the prominent area of focus. That transition away from fee-for-service is definitely engaging, resulting in an increasing need to engage clients.
Absolutely.
All right. Moving ahead. So this brings us back to really the topic of our webinar. How do you address these competing forces simultaneously in order to drive revenues and ultimately improve care for your health system? You don't need to be a magician to pull a rabbit out of your hat, but you do need to think like a marketer. It doesn't take magic to influence patient care and outcomes. It really just takes access to the right information.
Thanks, Rick, and the great intro. And I'm going to take a little bit of a different track here for the next section of the presentation. And we're going to go back to college a little bit for those of you, since a lot of you are marketers. And if you remember your Marketing 101, if you were an undergrad or your MBA, what's the first thing they taught you about? The 4 Ps. And promotion, place, product, price, whatever order you want to look at, and how important each of those categories are. Well, those are critically important in the healthcare environment as well. However, there's a 5th P when you get into healthcare, which is understanding the patient goals, the patient needs, the patient desires. And all of those other Ps that we were taught about of promotion, product, place, and price really need to be geared towards and focused on the eye of the patient. And so as we get into the next section of our presentation here, we're going to talk about the insights that we can bring to the table from a marketing perspective that help drive those behaviors. So some of this stuff is rudimentary. Of course you need to improve and influence the patient experience. Of course you need to attract new patients. But what are you doing to get those? Certainly the patient experience is involved with what's happening inside there. We just talked about those reviews. You're going to get great feedback on that. Society today is not afraid to share their opinions of things. So there's great information that you're able to get from reading some of that information online. How can we improve our services, doing patient satisfaction surveys, et cetera. How can you get new patients? Certainly you're going to have DTC advertising, marketing out into the area, but also focus on the referral basis. No matter how much we talk about the internet and those type of things driving patient choice, doctor referrals are still going to be a key part of any marketing strategy. How do you reduce the leakage? Once you have that patient, are you ensuring that you're overseeing all aspects of them? Not just to improve the financials. Of course, you want to keep that patient in from a financial perspective, but think about the continuity of care that's involved with that when your system has access to all of that information and they're not going elsewhere to get a certain procedure, service, product, et cetera. Then we talked about, Rick had a stat there, that 1.4 million, the total lifetime value of the patient. But think about the value of the family, and that goes even more so. Where that childbirth is going to happen. That might dictate not just the first 18 years of life of healthcare, where you're going to be receiving a lot of healthcare, but where then that family starts to really build and the additional children to come in that then become part of the ecosystem of the healthcare practice system that they're using. A few stats down here that we pulled, and then just the increase in trends, and you start to see this of what do patients want and what are they doing. This is from I think it was a PwC survey that we did here of patients, and how many, what % of them, if they'd gone to a dermatologist, would send a digital photo? Well, I'm sure if we look back in year 2000, the answer was 0. They weren't even thinking about that. But by 2016, half of them had. And that's even growing by 2018, 56%. And, growth when you start to get above half of the population doing something is hard. So it's amazing how much those type of things are starting to become more prevalent. I've had a live visit with a physician via smartphone. You'll see that's increased as well, 7% over the past 2 years. Stitches or staples removed at a clinic or retail store or pharmacy, a small increase there. I think personally that's going to be an area where we see bigger growth, especially with the consolidation, the CVS, Aetna, some of the mergers and acquisitions that are happening in there, and the minute clinics, those type of things. I think you're going to start seeing a bigger increase there of the healthcare being provided at a pharmacy location, at a clinic location, where it's easy to get in, you don't need an appointment, et cetera. Some of the things that you can do to drive those is make sure that you're on top of your referrals. So ensure that you know that Dr. Joe Finazzo, who in this picture here, that when he is sending his patients to Dr. Ryan or Dr. Kringle, you know where those patients are going, and you've got the outreach to Dr. Finazzo to ensure that he knows that you have the lowest readmission rates on hip replacements and the lowest hospital-acquired infection scores, and that your outcomes are the best. And why is it that Dr. Finazzo should be consulting with his patients about using your services, your facilities, et cetera? The next P, and this is really the first P in a sense when we get back from a marketing perspective, we look at product and place, and I think of them as being really intertwined in healthcare. because what the patient wants is the product in the place that they want it. So are you, as a healthcare system, providing what the patients want? And there's no question we know that they want easier access, more convenience, more mobile, more cell phone driven, those type of things. Are you providing those telehealth services? Are you providing them in locations that they desire? I heard an interesting interview, it was just last week. It was, excuse me, it was the CEO of Teladoc, and might run telehealth services, but one of the things that he was pointing out was in behavioral health care specifically, PTSD was the example he used. People who are suffering from PTSD, they can't go to a clinic. He said many cases the folks that they're talking to the first time are hiding in a closet because they're so afraid. Well, if that's the patient, how can you get that patient to, how can you assist and help that patient? It's got to be some sort of mobile or in-home care. Another example of that is, behavioral health clinics. People can be embarrassed to park in the parking lot of those. So how can you set these up where the patient's not going to feel that fear? Another example I was jotting down just as I was going through this was I watch a lot of sports, and one of the biggest commercials that's running right now is for Roman. And that's for some of those more embarrassing type issues. Where you can call a doctor, talk about your issue, whether it's erectile dysfunction or hair loss or some of the things that this is a men's health area for Roman, and have a consult with a doctor and get the prescriptions. And something that you might be embarrassed to talk to your actual primary care doctor about. But a doctor who happens to be in Montana that you're never going to meet again, you might be more willing to be open with them. So these are the things of what those products are that you're providing and also the place that you're providing them. Not just telehealth, but home health. Do you have a home health offering as part of your solution suite, or do you at least have a partnership with one of the larger home health providers out there? What about home infusion services? There's a recently approval by Medicare to start allowing home infusions going forward. So you're going to see more and more of infusions going on in the home. Other expansion and expansion opportunities in the urgent care clinics and retails that are popping up everywhere. You also want to look at, when you're going to plan for this. What's the data that you can use out there to see what the cost is going to be? It's not free to expand your services, as everybody knows. So when you're thinking about what that patient wants and where they want to receive it, there's a cost that you have as a health system to get that in place. So you can look at data. What you see here is some telehealth claims. This was a trend of, I want to say this was over a 3-year trend of the volume of telehealth claims, and this was over a 50% growth rate. But looking at that and looking at some of the financial metrics when we get into price next to figure out what is the ROI going to be for providing these services, not only for that service, but then from a broad perspective of, again, keeping that patient within your network. Promotion. This is always a little bit of a stickier subject in the provider space. When we talk to pharmaceutical companies, it's easy to talk about promotion. That's what they do. They're out there. They've got sales reps that are out promoting their product to doctors and consumers via DTC, et cetera. It's a little bit trickier in the provider world, but the concept from a marketing perspective is still the same. You need to let your customers and your referral sources know how great of a job you're doing. And having the right physician alignment strategy, ensuring that you're talking to the physicians in the community, if you're a children's hospital, making sure that they understand why in the world would they ever refer a patient to the general hospital. We have such better solutions for pediatrics. Keeping that clinically integrated network so you have the whole view of the patient's continuum of care. Of course, you want to reduce the leakage, and then we underline the word focused here, because identifying those areas for growth that are going to be profitable to your organization and beneficial to the patients is the most important aspect. And the last P, price. Understanding the cost of expanding those services. Understanding that you need to be moving your patients toward the lowest cost care setting. As you know, that you might make more revenue by having a patient inpatient, but you're going to pay a bigger penalty if you don't have the right care being provided at the lowest cost location. Also goes hand in hand with what the patient wants. Minimizing your leakage, reducing, again, that patient who's going outside of your system for rehab after their surgery. Going to a skilled nursing facility that's not part of your system and you don't have a joint venture relationship with. Then understanding reimbursement. Understanding what insurers are paying. Obviously, you know what you're getting reimbursed, but understanding what the going rate is in the market and how to negotiate with the insurers to ensure that you are getting the appropriate level of reimbursement for particular procedures. What you see right here is some information. This is a handful of immunoglobulin drug codes in the IG space. But you can see it's amazing the difference in some of these products, what the average reimbursement rate is between the Blues and Uniteds and CMS. And understanding that, and then understanding what the reimbursement is to the other facilities within your area, within your market, is critical to make sure that you're maximizing your revenue opportunities. So with that, I'm going to be turning it back over to Rick, and I believe we do have another poll coming up here next. And which of these goals is the most important for your organization? And clearly when we have these poll questions, we kind of know that all of them are important, but are you more focused on increasing your referral volumes, minimizing your leakage, maximizing your utilization of system-owned facilities, shifting inpatient procedures to ambulatory settings when appropriate, or formation of clinically integrated networks and ACOs?
The poll will be closing in 20 seconds.
And it looks here, as we're looking at the results coming in, that increasing the referral volumes and maximizing the utilization of the system facilities are clearly the lead in this case, which, knowing the audience and the presentation focus of marketers, does make a lot of sense here to me.
Yeah, and keeping that data in-house keeping those patients in-house allows you to more effectively provide an end-to-end positive consumer experience overall. All right, well, thank you, Tim. Appreciate it. Moving back to our agenda for a moment, we'd like to spend the remainder of our time today discussing what types of data can really influence costs, outcomes, and ultimately the patient experience. So marketers are really only as good as the data they can use in many respects to inform their strategies. Accessing and gaining access to quality data and insights is both imperative in order to have the proper perspective of the marketplace, to really gain a greater understanding of your competitors and how they're operating in the marketplace, and ultimately influencing provider behaviors as well. With the right data and analytics at your fingertips, marketers and strategic planners have an opportunity to act on this intelligence and really direct their organization more effectively. This could include gaining market insights, influencing facility, care utilization, optimizing referrals, which we saw in that last poll, is certainly something that folks are very top of mind. Deciphering network leakage, improving provider alignment, and ultimately understanding reimbursement and what that can mean to your business. The quality and quantity of data is also important. And I'd like to draw attention to the fact that data is messy. It has holes. There's gaps. So identifying sources that can really provide you the greatest picture and effectively link and resolve data despite how it changes over time is critical for you to be able to have intelligence that is not only valid at that present moment, but continues to be valid moving into the future. So this brings us to what we're going to talk to as really the three legs of our stool. As organizations work to provide actionable and impactful intelligence to our marketing and strategic planners, This first leg is what we like to think of as volumetrics. Organizations often have a firm understanding of the who they do business with, who participates in their practice or network, who is last seen in network. But the how is the piece that often goes unknown. How your providers are practicing compared to their peers. How do your competitors practice? Marketers and strategic planners have an opportunity to look beyond your in-house data and use outside data sources in order to obtain a full picture of different physician and facility patient volumes, procedures performed, and the care setting that was leveraged. This intelligence can be used in a number of different ways, but is often seen tied to market research and positioning, physician outreach, improving facility utilization, and recruitment and network integration. Let's take Dr. Great, for instance. Would you know if he's performing at facilities outside or if he's performing at a higher cost setting? Possibly, but we often hear that this knowledge is largely situational and limited. Volumetrics can change this. It can shine a clear, bright light on his how much time he spends at each medical center, the percent of knee procedures he does at each location, and more. Tim, would you like to add?
I was going to say this one here hits the nail on the head of 17% of the people who were focused on maximizing utilization of system-owned facilities, and ensuring that when folks are doing procedures, that they're performing them in network. If you have an infusion chair, you have a body in that chair as much of the time as possible, those type of things. So I think this hits nicely with that business goal that we were looking at before.
Thank you, Tim. And then after a patient has visited someone like Dr. Great, the next question that naturally arises is, where did that patient go? This brings us to what we think of as our second leg of the stool, referral networks. Only by leveraging significant claims data sources outside can marketers and strategic planners really know and expand their knowledge of whom went where and why, really uncovering previously unknown provider relationships, connections, referral targets, and ultimately the situation we'd all like to avoid, network leakage. By evaluating referral networks, you can identify the risk in care and costs that are results of patients leaving your system, quickly telling you if Dr. Joe sends patients to Dr. Ryan, who's in-house, or Dr. Kringle, who sits outside of your network. Your organization can also leverage referral networks in a multitude of different ways, including leakage mitigation, which we've already discussed, but also patient acquisition, post-discharge care management, and recruitment and network integration. And remember that each opportunity to keep a patient within network ultimately results in a greater opportunity to improve their experience and really provide direct control over their care outcomes.
I think you hit the nail on the head there, Rick, and I think this is the low-hanging fruit is identifying those referral sources where you're not getting business today. The other part is identifying where are you not providing that continuous care from patients and where are they going when they leave the system or going elsewhere, and how can you plug those holes and fill those gaps.
Thank you, Ben. So this brings us to really the final leg of our stool, bringing us full circle. Once we know what they did and where they went, the next piece is really understanding what they cost. And this gives you opportunities to not only understand the ROI that's tied to those patients and providers, but also how your competition is pricing and really what contracting models you may want to leverage as you make strategic decisions moving forward. Reimbursement insights provide strategic planners and different market intelligence that they may need as they consider things like geographic expansion, as well as other opportunities for their organization to really maximize the remittance rates that they might receive across payers or facilities.
And
go ahead.
This is going to be critical and imperative, certainly for any new areas of focus of understanding the ROI on expansion of services, those type of things, but also in negotiations and ensuring you're maximizing your revenue for the services that you offer today. So having a really thorough understanding of that reimbursement landscape can be very insightful and very beneficial.
Thank you, Tim. So this kind of brings us full circle. Ultimately, these three legs can help different provider organizations grow their service lines and increase their market share. by increasing referral and procedural volumes with claims-based intelligence, really about the practitioners and the facilities that are providing and influencing care throughout the different geographies that you service. So again, volumetrics, that what they do, referral networks, where did they go, and reimbursement insights, what did they cost. These three together can provide you a full scope and full view, or holistic view, so to speak, of a patient that enters your system each step along the way, from the doctors that they go to where they're referred, and ultimately where they impact the bottom line of your business as well as the payers for reimbursements. Tim, did you want to note anything else on this before?
I think this hits the nail on the head, and I think we'll have a few thoughts in closing here, and then I think there's one more question that we have for the group.
All right. So I believe there's another poll getting ready to start. And bear with us one moment. There we go. Our final polling question of today. So as the role of consumerism continues to grow, does your organization leverage third-party data to understand your market's growth opportunities and gaps? A, yes, we use a third party. B, we rely only on internal data sources. Or C, we don't use any data sources at this time. And we'll give it just another...
The poll will be closing in 15 seconds.
Interesting, and yeah, we have seen that too. There's been a rise in third-party data utilization, across the provider industry.
And again, that goes back to really the quality of data that you represent. I mean, in many ways, we've all heard, more data is better, and you definitely want to have that full picture of the landscape that you're interacting with in order to make sure that all the different types of care settings are captured, the different populations are captured. But another key component of that is intelligently linking that information together. And that's not just at a claim level, but at a provider or practitioner level as well. We see within the industry a lot of change occurs at that practitioner level in terms of location, contact information, all of those bits and pieces. So knowing not only that you have the most viable targets, but that you have the most effective way to get a hold of them and where they're currently seated is intelligence that can go a long way and is often challenging unless someone is really doing effective identity resolution behind the scenes.
In summary, we're health systems and all of us are faced with really difficult decisions. The shift to value-based care, reducing cost, increasing performance, outcomes focus, and most importantly, improving the patient experience overall. And decision-making for these is becoming improved, going outside the organization to identify where can we garner information, where can we learn from data, where can we learn from analytics, where can we learn from what other folks have done and been successful with. And insights that we can derive from medical claims data, referral analytics, can help this and help improve care, quality, lower cost, getting it back to that triple aim that we started with here today. So we're going to turn it over for questions. Just a quick note, if anybody is interested in more about what we do, we'd love to talk to you. There's a lot of work that we do in the provider space. I think it's a lot of great stuff. Our website is physician-referral-network.com. You're welcome to go there and learn a little bit more. You'll also see up here on the screen email addresses for both Rick and myself. So feel free, obviously, to contact us. And then we do have some time at the end. We want to make sure we have time if there's any questions from the audience. Please let us know, and we're happy to discuss and answer anything.
Thank you, Rick and Tim. We are now at the Q&A portion of today's call. Feel free to type your questions into the Q&A section located on the right-hand side of your screen. Do we have any questions and or comments at this time? And while you're formulating your thoughts and typing in your questions, I'd like to let everyone know those of you registered for this program will receive the webcast playback recording on tomorrow, Thursday, May 16th. Do we have any additional questions and or comments at this time? We do have one question that has come into the Q&A. What role do you think data or analytics can have with regard to reimbursement trends?
I think I can take that one, Rick, from my thoughts, and you can chime in if you have any more. This has definitely been an area that has been a huge focus of a lot of the customers that we're working with, is identifying what the different insurers are paying, both from a commercial perspective, an Advantage perspective, a managed Medicaid perspective, those areas, and how those are shifting. There have been some other areas where there are massive cuts in procedure, product things, and other areas that are new and different payers are very high deviation in payment rates for especially things that are newer procedures, newer services, et cetera. So understanding that landscape and having a dynamic market or dynamic understanding of the market is imperative and critical.
Tim, just adding to that, I know we've also heard from a number of different clients that they are using reimbursement information and insights in order to really understand not only ways that they can maximize remittance across their different payers and facilities, but also as they're looking to expand into new geographies. They want to understand if it's a viable market, an area that they would want to consider for expansion. Many times it requires really a high-level assessment, looking at the different procedures, different needs that might arise from a practitioner or facility standpoint within a new region that they're considering expansion into.
Great, thank you so much. And then another question. Why is transparency into referral patterns important for organizational growth?
I think the key there is easy. It's understanding which doctors out in the community are referring patients outside of your network. And especially if they are tightly aligned or employed within your network, making sure that they're keeping their patients in there. Again, not just from a revenue perspective, but all the continuity of care benefits that are provided when you have the full continuum of care being provided for a given patient. So I think really understanding, knowing where those gaps are and knowing where patients are going elsewhere for care is critical. Some of it's going to be things that you can't provide. Again, an example from myself, I got my flu vaccine at CVS just because it was easy. I'm not going to go set up an appointment to do something like that. But anything that would need an appointment or worth a little bit more is going to be something that's imperative that you have an understanding of in order to make sure that you're aware of and trying to influence and keep those patients within the network.
Thank you very much. And to those attendees that see the link in the chat area, that is the link for the Physician Referral Network. Thank you for asking, Kara. Do we have any additional questions, comments? Okay, gentlemen. Go ahead.
No, this is Rick. I just wanted to thank everyone for taking the time to join us this afternoon. I know you all have busy schedules, and I hope this was informational. And we'd love an opportunity again to discuss other ways that we can help your business accomplish many of these different goals that we've discussed today. So thank you all again.
Thank you, everybody.
Thank you, everyone, for joining us for today's call. A copy of this recording, along with a copy of the slide deck, will be provided in a webcast playback email that you will receive on Thursday, May 16th. I'd like to thank you for joining us again, and have a great rest of your day.